So the difficulty with both of these treatments, however, is there is a bunch of different companies that sell the tubes that actually lead to you being able to create either PRP or PRF, and there's no one standardized protocol. So if you've got PRP up the road or PRF, even in the same joint sometimes, in the same place sometimes, you're going to get variations in the outcome. So in the way that they spin the blood, what is in the tube that they spin the blood with, and then the way that the person injects it. If it's freehand, then you're going to get a different result every time you see the person, versus if it's with the device that injects it in a methodical way. So the evidence is still lacking on a grand scale. With PRF, with PRP, it's slightly better, but still only 10 randomized controlled trials. Looking at PRP for androgenic alopecia is relatively limited in my view. But what separates these two, at least on the third metric, is the evidence and the expectations. So the expectations would be if you had PRP, well, you know you're going to have more coverage of the scalp and you're going to be having the best chance of success if you've got mild to moderate hair loss. Whereas if you're using PRF, you're not going to be able to cover the entire scalp necessarily, and you're likely going to have a slower release of those growth factors, but still, it's going to be something that you want to use if you're in mild to moderate stages of hair loss. And in most cases, you're actually going to get a better result if you have both, because the platelet-rich fibrin can make those platelets sticky. And so you can have both a short burst of those growth factors, and then you can have a bit of a sustained release of the growth factors as well.